Interesting thing is for centuries, women have had the average age of menopause be 52-ish. So the problem is that we used to die before menopause. And when you go back to medieval times, and I joke with my patients about this all the time, is that most of us died in childbearing. If we were lucky enough to make it through childbearing, the powerful men in the world decided to burn us at the stake because they thought we were heretics or witches. Because we were either crazy or they just wanted to cheat on us with other women and all those wonderful things. But the bottom line is we were toast. We never made it to menopause. So that average age has not changed. Now we're living 30, 40, 50 years beyond menopause, depending on what time you go through that. So we are not, everyone asks me, well, isn't menopause a natural function? Well, yes, our ovaries are designed and they're destined to lose their function. We are just now living longer and suffering the consequences of those hormonal decline. So before we never got that far. But as I always say, karma's a bitch, because now women are living longer than men. We got even finally. So when you look at hormonal decline too, the other thing that I find is interesting is we think menopause is an absolute event. Okay, one day you wake up, you're menopausal, your ovaries shut down, and it's it. Well, if I wish it was that easy, it's not. It's a 2-decade process on average. So if you are genetically pre-programmed to have menopause at 50, you're going to start to have symptoms in your early 30s. But the question is what are those symptoms and how do they take effect? Well, it starts very insidious, and it almost starts to become a new normal to the point where you don't even know what normal is for yourself anymore. You just think that's what life's all about. But also, you're having different things fail at different times. If you look at this slide here, the top line is estrogen decline. The bottom line is testosterone decline. And it's very important because, sorry guys, but biologically women and estrogen are much smarter. And it's no offense, I love the guys, but biologically, estrogen is made by the ovary and it's stored for a rainy day. Where do we store it? We store it in our fat cells. So women who are actually thinner go through a much harder menopause than women who are heavier. So this is one place where we get even with the little skinny ladies. So okay. So when we look at estrogen, it drops slower than testosterone because it stores in fat. Testosterone is just like cash. You spend it, it's gone. So if you think about it, we have less testosterone overall than estrogen. Very close, though, when it counts. And we also store estrogen. So when our ovaries shut down, the first thing to go is going to be testosterone. Second will be estrogen. So in our 30s, we start suffering from testosterone deficiency. The second a woman shows up and has a hot flash, her testosterone is already gone. So we'll talk a little bit about what those symptoms are, but if you have had a hot flash, night sweat, or any one estrogen deficiency sign, which we'll talk about, you are already testosterone deficient. So when we talk about these other symptoms and the ratios, women, you make 60% estrogen on a day-to-day basis and a 40% of testosterone. 40%, that's a lot. But what are those symptoms? So if you look at estrogen, it's hot flashes, night sweats, mood swings, insomnia, dry skin, forgetfulness, vaginal dryness, heart palpitations. But look at testosterone deficiency, decreased mental sharpness, low libido, muscle pain, decreased motivation, anxiety, and depression. Mother Nature's serotonin is testosterone. You lose your testosterone, you lose all your capability to cope. So what I call it is the stupid people rule. Stupid people really piss you off more than they ever did before. That is testosterone deficiency. Weight gain. Weight gain is a huge problem with testosterone deficiency. And here's the real terrible thing that goes on. Number one, you start putting on weight, you're feeling tired, and you're just feeling bitchy and just really irritable. So what do doctors do? Prozac. They put you on an antidepressant. You know what those antidepressants do? They lower your testosterone even further. So it becomes this cycle where you feel better for a little while as the serotonin kicks in, then you continue to drop your testosterone because those drugs lower it even further, which makes the symptoms even worse. So you start to gain weight even more, which makes the mood worse, and it just becomes this really bad negative cycle. And eventually what happens with that weight gain? You start to develop cardiovascular risk, prediabetes, lipid disorders, cardiovascular disease. So what do? We give you more medicines. And those medicines probably exacerbate it even further. Most people that come into my office that are pre-diabetic, they have a testosterone deficiency. The second you give them testosterone, their sugars normalize. And we have thousands and thousands and thousands of people on metformin, diabetes drugs that could get off of them just by putting them on testosterone. And within 1 month, I see this happen every single day. We get people off meds because the root problem is testosterone deficiency, not prediabetes, not lipid disorders, which are caused largely by testosterone or thyroid disorders. But you won't look for those things if you don't know about this key piece in the body. So estrogen and testosterone really work nicely together. If you put a gun to my head and say, which one would you have to choose if I had to pick one, I'll take testosterone all day long. Because you need estrogen to reproduce. You do not need testosterone to reproduce. It just makes you feel like you want to. However, estrogen, you don't really need it to control as much as far as blood glucose because testosterone moves glucose into the muscle burns it clean, gone. You lose your testosterone, you don't manufacture and process sugar well, you start to gain weight, you start to feel lousy, you get moody, anxious, and all those things. It is the feel-good hormone. It's the one that prevents us from developing heart attacks. Testosterone's got it going on. That's why those guys always lose weight faster than we do. We always ask why, because they have more muscle and they have more testosterone. They burn sugar better biologically. So some days they'll have hot flashes and their bodies will change too. I love this thing. That's what happens to us. Our bodies start to change with those deficiencies. So what about you guys? Let's have some fun and talk about the guys. They're like, oh crap, here we go. So testicular failure, I love that word, testicular failure, or actually 2 words. So you guys start to get a decline in testosterone just like women do. But it happens a little later than us. You guys are about a decade behind us. We always said you guys matured a little slower than us. But you guys are about 10 years delayed. Typically where women start to lose their hormones, it's in the late 20s, early 30s. Guys start to lose their testosterone on average late 30s, early 40s. But there are things that can accelerate that, and we'll talk about it. But that estrogen thing that you guys are kind of a little disturbed to hear about right now, you guys have that estrogen, but as testosterone starts to decline, you get a relative increase of estrogen because now that ratio is off. So you start to become estrogen excess, which makes you guys cry, like Hallmark commercials, gives you the excessive breast tissue, puts on weight, and the most dreaded thing is impotence. That's estrogen excess. And you also start to struggle from the testosterone deficiency symptoms that women do, coping, irritability, mood disorders, weight gain, cardiovascular risk. All of those things happen to you guys too. So a lot of guys who end up with those heart attacks in their 50s and 60s is because they're testosterone deficient. So with this other thing with estrogen excess, a lot of the reason guys come to see us is because they're impotent. I always joke with my patients is that there's 2 things that I get a guy to go to a doctor. Number 1, an ambulance. Number 2 is impotence. So that's where they start to come in the door. Estrogen and testosterone deficiency. So as I said, guys make 5% estrogen every day and 95% testosterone. So they're not as well balanced. They are loaded with testosterone. If a man starts to convert too much of their estrogen or too much of their testosterone